Hi, in this video, I'm going to discuss when you should worry about your daughter not having started her periods. So, as usual, let's have a bit of background. Periods start when the brain hormones wake up the ovaries to say start maturing your eggs and start producing some estrogen. Before puberty, girls have no estrogen at all, therefore, the lining of the womb remains nice and thin, and there's nothing to come away as a period. When do we expect periods? Well, we expect periods when the ovaries wake up, estrogen starts to be produced, and initially, estrogen starts to be produced in very small amounts, and this is way before we expect periods to start. As the concentration of estrogen rises, it thickens the lining, and then it starts to come away as a period. Now, talking about puberty, periods aren't the first sign of puberty. The first sign of puberty in girls is usually a growth spurt and breast development. You also have hair growing under the arms and on the vulva, and these are all earlier signs of puberty. One of the most constant things in nature is that we expect breast development, and then 2 years later, we expect the first period. So basically, what I'm saying is that we expect some development first before period starts. We expect a growth spurt, and we expect the breast to start developing. Because we know that there's usually a 2-year gap between breast budding or first breast development called thelarche and the first period called menarche, it may be useful just to keep a little note of when breast budding first happens in your daughter. I see lots of girls, and it's really useful information to be able to work back as to when breast budding or thelarche started. So if you keep a note of that, we'll know whether she is within that 2-year time frame or significantly outside of that 2-year time frame. And that can influence what investigations we do and the timing of investigations, and whether we say, well, let's just reassure and monitor things for a few months to see if they do kick on. The average age of breast starting to develop is about 11, but this can be earlier, and therefore the average age of period starting is about 13. And about 95% will have had their first period by the age of 14. However, we are all different as human beings, and we all have different rates of maturity. Like our heights are different, so too we develop at different rates. So when should you worry? If your child has had no development, that is, she's not had a growth spurt, she has no breast development by the age of 13, then that's a bit delayed and we wonder why that's happening. So if no development and no periods by the age of 13, then you should go along to your GP. If, however, on the other hand, she has had a growth spurt at some point, she has had some breast development, then it means that there are hormones in the mix and she is actually developing, so that we give this to age 15 before we say, let's check this out. So therefore, no periods before age 13, in absence of all other developments, so nothing happening, no signs of puberty by 13, or if she has signs of puberty, then allow her up to 15 to start her periods. So just as an end, I'll say that girls who have no periods and have no other development, then this is probably more likely to be a hormonal issue. And I will go into this in another video. On the other hand, girls who have development and yet, so these are the ones who haven't had periods by the age of 15, those who have development and have not started periods by age 15, then it is a bit more likely that this is not a hormone problem because they are producing estrogen because it's the hormones that give them the growth spurt. It's the estrogen that certainly gives breast development. So something is happening. However, if no periods have started, and particularly if 2 years have elapsed between breast development starting and period starting, then this is less likely to be a hormonal cause and more likely to be an anatomical cause or a structural cause. So those are the two main camps. A third option is that we call constitutional delay, which is that actually she is maturing, but maybe a bit more slowly than her peers, and everything is happening a bit later. And there may be a family history of this, but still, just to be sure and just to make sure there's nothing we're missing, we still say go along either at age 13 if she's had no development or age 15 if she has some development. I would say also, if your daughter has not had her first period and she has crossed her 16th birthday, regardless of anything else that's going on, I'd say please take her along to her GP so that she can be investigated appropriately with blood tests, and we usually do hormone tests. We also usually do imaging, ultrasound scans, and referred as necessary so that if there is anything amiss, we can find it as soon as possible. I hope you find this video useful. I hope it's reassuring in many cases because people sometimes don't know what the normal time frames are and when you should worry. Please subscribe to my channel, like this video, or please join us on my Facebook group, Gynecology Girl Talk, where we'll talk about all sorts of gynae issues in children, tweens, teens. Thanks for tuning in.